So we're going to discuss about the management of advanced phase of myeloproliferative neoplasms, which is a term that describes the high-grade transformation to a status of the disease that resembles acute leukemia, in which patients have progressed to disease that is undifferentiated and immediately life-threatening to the patients. We've also learned a lot about the process in which patients with low-risk diseases transform. So we've learned about clinical predictors, we've learned about molecular pathways in which patients progress from their baseline MPNs to the more advanced phases of MPNs. And that was the wonderful work of many of colleagues. Unfortunately, we have made more strides at understanding the biology than designing interventional clinical trials that can slow the progression. So the clinical trials trying to address the MPN in blast phase and accelerated phase have been very few, and those patients have been systematically excluded from prospective interventional trials for acute leukemia, especially acknowledging the poor prognosis they will come and their known resistance to therapy. So a lot of the information we have is extrapolations from clinical experiences, as well as single institutions and retrospective studies and retrospective cohorts. So far, we know that some of the concepts that apply to acute leukemia can apply to patients with MPN accelerated phase, including therapy with single agent HMA, aggressive therapy with intensive chemotherapy followed by allogeneic stem cell transplantation in select patients, as well as the combination of HMA and low-intensity therapy with more novel agents, which is gaining more momentum. So we look forward to completion of a few smart, well-designed clinical trials that are utilizing pathways that are novel and implementing the translational research that we achieved into designing rational and clinical trials that can help patients. Hopefully we'll hear about that in the future, and we'll be having more to offer these patients who have very poor outcomes. Also, emphasis is going to be more about slowing progression or preventing progression if there's more tools to achieve that in the future.